Welcome to the Pharmacy Podcast Show. You're listening to the first and only podcast dedicated to the business of pharmacy. Hear from independent pharmacy owners, leading entrepreneurs, political strategists, healthcare technology trends, career coaching, interviews about our pharmacy industry, and more. Be sure to subscribe to the show via iTunes and leave us a voice comment from our contact section on the website. You can find all of our episodes at pharmacypodcast.com.
So hello, this is Papatya Tankut, Vice President of Pharmacy Affairs at CVS Health, and you're listening to the Pharmacy Podcast.
Hey, Pharmacy Podcast Network listeners, this is your host, Todd Urey, founder of the Pharmacy Podcast Network. I'm excited. This is part 2 of a very important series called Building Your Pharmacy Career, which is sponsored by CVS Health Careers. Think of this. Millions of times a day, pharmacists are helping people on their path to better health, from advising on prescriptions to helping manage chronic and specialty conditions. Pharmacists are needed so much so, especially with some of the disease states that have cropped up, with specialty pharmacy really becoming evident and much more important in documentation and collaboration with specialists and physicians. So being a pharmacist is more important than ever. We actually interviewed Dr. Colin DeWald, who is a PharmD with CVS Health, and we're very excited to have him on the show. And today I want to introduce to the show, as part of our second part of this series, Dr. Papatya Tankut. Welcome to the Pharmacy Podcast. How are you today?
Good, thank you, Todd. Thanks for having me.
So, not to take you back at the very, very beginning, but it's very important for the listeners to really understand, especially some of these P3, P4 residency pharmacists that are out there. But tell us, what made you want to become a pharmacist from the beginning? And then tell us about the beginning of your education, which I believe was the University of Maryland School of Pharmacy.
That's right. So I knew relatively young that I wanted to be in a healthcare profession, but I wasn't necessarily sure exactly what path I wanted to take. And I remember when I was 16 years old, my mom took me to an independent pharmacy in the neighborhood. And we saw the owner, who happened to be a pharmacist, and said, "My daughter's looking for a summer job or a part-time job. Do you have anything?" And I think that's really where it all began. I had the opportunity, to work in the store just as a regular clerk, and she actually exposed me to the work that she was doing in the pharmacy. And it was a tiny, tiny neighborhood pharmacy, but I got to really see the work that she did interacting with patients, and that got me interested. And she was actually the first individual that took me to a pharmacy school, and she happened to graduate from a pharmacy school, Howard University in the District of Columbia, and she just drove me around and showed me the school, and that really got me interested and excited. And so I applied, and I got accepted to the University of Maryland School of Pharmacy, which is really kind of where my pharmacy career began. And I graduated, 23 years ago in 1994. And ever since I graduated, I have been working for CVS Health, at the time CVS Pharmacy, and wow, have we changed over the years during that period of time. But I've had the pleasure of working as a staff pharmacist in the Washington metropolitan area when I first began as a pharmacist. And about 4.5, 5 years after having that direct patient contact, and I loved being a pharmacist in our stores. I gained such great patient relationships and really just had a great time with my colleagues in the stores, making a difference and really just finding that so rewarding that you can make such an impact on my patients. And that's when I got into field management, again within the Washington, D.C. area, and that was really around pharmacy recruitment. So my role and responsibility really was around recruiting pharmacists and students as potential prospects for CVS pharmacists in the future. And I had the great opportunity of going back to my alma mater, as well as other schools in the Washington metropolitan area and central Pennsylvania, and being able to talk about the experience I had at CVS Pharmacy and why, beginning and ending your career at CVS was a great place to be. And that's really kind of how I began my career.
So talk to us a little bit about the transition to becoming the director of pharmacy recruiting. That seems very special because now you're taking everything that you've learned and you're in the mix and you're really able to assess who are these candidates to really help our team grow in the direction that we want to grow. So tell our listeners a little bit about that opportunity of being Director of Pharmacy Recruiting.
That's right. So I spent my career began in the Washington metro area, as I mentioned, as a pharmacist and then as a pharmacy manager and the manager of professional college relations. And then I was asked to take on the role of Director of Pharmacy Recruiting. And that was a big job for me. One, because it meant relocating to the corporate office, and having a corporate role is very different than having a role in the field, in the area where I went to school and where I really grew up at CVS. But it also meant additional responsibility where you had an enterprise view of how important it is to have the right people taking care of our patients and our customers in our stores. And that's when I had the opportunity not only to have an influence on the students and the pharmacists that we were recruiting in the Washington metropolitan area, but really being able to create the strategy for hiring pharmacists across the country. And that was a time when CVS was really doing a lot of acquisitions. So I had the really unique opportunity of being involved in acquisitions with Eckerd Pharmacy, Savon, Long's Drugs that was in the West Coast and Hawaii, and being able to see talent from pharmacy schools across the country, being able to articulate why CVS was a great place to work, what type of pharmacists we were looking for, assessing the talent that we needed in this evolving landscape. And even back then, the role of pharmacists was so important, but it was beginning to change. And pharmacists were playing even more of an integral role in kind of the healthcare delivery system. So having a team and being part of identifying that talent and identifying great pharmacy students that would be future pharmacists and leaders for our company was really a great opportunity. And during that period of time was also when there was a shortage of pharmacists in the country. And so being able to differentiate CVS from the others was a key component of what the team was responsible for.
So let's talk about that. So I've had a background in obviously starting out with long-term care pharmacy in the technology sector, and then the combination shops. Those were these long-term care pharmacies that also had front ends to open up doors to their community as retail pharmacies, community pharmacies, and then also the evolution of specialty pharmacy. I know you've seen probably all aspects of that. So how does CVS Health stand out in the pharmacy sector of healthcare as something special, so that if I'm listening to the show and I'm considering a career move or I'm just starting my career, why would I be attracted to CVS Health?
The way I look at that is the pharmacy profession and the overall landscape of pharmacy has changed and continues to evolve every single day. And along with that, I think the companies have had to evolve. And what I've really enjoyed working at CVS is it feels like a completely different company for all the right reasons today than when it was 23 years ago when I was a student graduating from pharmacy school. And I think what I tell a lot of students and pharmacists even today is that CVS Health in its current construct is a pharmacy innovation and a healthcare company. It's not just a neighborhood drugstore anymore. It's not just a pharmacy benefit manager company, but it's encompassing, an opportunity for somebody from what I call cradle to grave. You can begin at CVS and be, whether it's a retail pharmacist, a long-term care pharmacist, a pharmacist working in one of our mail order facilities, and you can move along a career path in so many different sectors that you'd like to go in under one umbrella and one roof. And I remember when I was going through pharmacy school and having to make that tough decision as far as what career path I'd like to take, I, as an intern, when I was in pharmacy school, worked at the local hospital, while at the same time when I went home, worked at the independent pharmacy. So I had a natural affinity for retail pharmacy because of the patient interaction, but I also love the hospital piece. And it was a really tough challenge for me to say, which one am I going to choose when I graduate? Now when I think about the student coming to CVS Health, why it's so unique, you can actually practice all those different avenues of pharmacy under one umbrella. Whether you'd like to do the long-term care, whether you want to do more patient intervention, whether you'd like to do retail pharmacy, you can do that too. And in addition to that, when you think about the other non-traditional pharmacy venues that you can do, CVS Health has those too. I've got colleagues and friends, and mine today, being in public affairs and corporate communications, is probably not a place where I thought I was going to end up. But with the opportunities that are available, you can, whether it's merchandising, government affairs, clinical operations, therapeutic management, product innovation. There are so many different places the company allows you to explore that it really feels like a different place. And you can go, as I mentioned, from your first day as being a licensed pharmacist to the day that you retire, and having all of these experiences feel like a very different company, but the uniqueness of having it all under one roof.
What's your advice for someone listening to the show who is at the inception of their career and they're looking for the right role in community or senior care or even a specialty-specific disease state? What type of next steps should they take if they're coming out of, let's say, their P4 phase and they're entering possibly a residency? What kind of advice can you give to them?
You know, Todd, what type of advice I think, I've said along the years as well is be open to all the opportunities that are available to you. Learn as much as you can throughout the way, and don't be narrow-sighted to what the opportunities could be. Most people, when you're going through finishing pharmacy school, going into a residency, you might have kind of a desire of where you think you'd like to go. You have a desire of what you think you might want to do, but the reality behind it is that you've got such a great education through pharmacy school. You have such expertise. As pharmacists, we play such an integral part of the healthcare delivery system that I would advise and ask you that you keep your mind open and explore the opportunities that are out there for you, and learn as much as you can. Speak to as many individuals as you can as far as the career path they took, what they've learned, and experience as much as you can. I think that's the key. We can play such a key role in helping patients on their path to better health, regardless of the role that you take and the path that you take, but be open to exploring them and gain those other skill sets that will make you that much more marketable and that much more effective as you move forward. So learning, kind of how to be a good leader, understanding how to work well with others, understanding how professionals work together, and how pharmacists can play an integral role in that, I think is really something to take to heart and learn as much as you can before you go out into that real world.
Great, we'll be right back.
But first, a word from our sponsor.
Hi, this is Jessica with CVS Health Careers. Our pharmacists have many reasons to love their career, from having programs designed for learning and career advancement to making a genuine difference in people's lives every day. Find out how you can be part of the dedicated team of pharmacists working to help people on their path to better health. Apply today at jobs.cvshealth.com. Now back to the Pharmacy Podcast.
That's really interesting to think about, because your cradle to grave scenario for a new graduate it provides a lot of hope, especially when we hear the naysayers out there saying, hey, there's going to be too many pharmacists and there's going to be too much competition and maybe that's not the career that you want to take. But every time I go to a national conference, every time I go to see someone speak on the business of pharmacy, whether that's in technology, pharmacogenomics, medication therapy management, a very specific disease state in cancer, or HIV, or Hep C, those presentations are filled with hope. I mean, they're filled with everything that needs to be done from a pharmacist's perspective. So I still don't see, even though the metrics or the numbers might say that there might be a surplus of pharmacists, if you're a go-getter and you have hustle in your step and you want to make changes and you want innovation to take place, I think there's opportunity there. So my next question is about opportunity. Talk to me and talk to our listeners about the CVS Health opportunity for a pharmacist in their future.
Yeah, I couldn't agree more with you. And I obviously a huge fan of CVS Health. I've spent my entire career here, and I would tell you that, without question, the opportunities at CVS Health are endless, and primarily for some of the points that you made also. When I think about a CVS Health pharmacist, I'm not thinking about someone who is just a retail pharmacist, someone who is just in a mail order facility. I'm thinking about all of those things that you mentioned as well. It's that individual that can make a difference in the lives of our patients in a variety of different places, whether you're providing your analytical skills, whether you're providing your clinical intervention skills, whether you're providing your customer service skills and patient care skills for that sick patient at the counter, whether you're thinking about how you can make a difference in a new innovation, a new product that's going to help our patients and help our customers. I think it truly is endless from that perspective, and the places you can go, the departments you can fit into, whether you're looking for a frontline position. And we recognize over the years, and the hundreds of people that I've spoken with, is that some people like to be on the front line. They're very, very content taking care of patients in the direct front line, whether it's on, the specialty side, the long-term care side, the retail side, or the mail order side. And then you have others that aspire to do more than that and to be in leadership positions. And the company really has invested a tremendous amount in creating leadership programs and training programs that allow that individual to start at the front line and understand the business and understand the core of how patient care and business plays a role and how you have to have both to be successful. But then you can move into a leadership role where you're now leading others and supervising others to drive the business, to drive patient care, to drive results. And then from there, you move into either more strategic positions, or you move into innovation roles or product development roles, or you look at pharmacy from a different angle. And sometimes it's about how do you communicate what the company is doing externally to stakeholders and audiences and still promoting the value of the profession of pharmacy. And in other cases, you're able to do those through the actual work that you do. So again, I think it's really a great organization that allows you to say, here are my skill sets, here are my desires and my passion, and here's how I can make a difference. And I think there are so many different tracks to help you get there. And what's great is that we're still an organization that is really led by healthcare professionals and by pharmacists. So it's really inspiring to see that some of our most senior leaders in the organization are pharmacists by trade. And that gives you inspiration to know that, the limit is endless. I mean, there's a lot that you can do if you have that drive, if you have that passion, if you have that determination and that will to learn, to absorb, and to move forward, you can.
You graduated in 1994, and now after the time that you spent in different divisions with over 100 plus different places that you could be within the CVS Health pharmacy empire, you're now Vice President of Pharmacy Affairs. What pride must come along in what you've done in your career, but more so, even back to the logo of CVS Health, is there's heart in your voice. I can hear a passion in your voice, and I can hear sincerity, and that's what attracts me to people in the pharmacy sector of healthcare, is that passion. And it's something that's common among the pharmacists, who I think are the mover and shakers and the innovators, which is the passion. And the passion doesn't cost you anything. It's not part of a degree. It's not part of what you're going to learn in school. You have to bring the passion with you. It has to be part of who you are. And I think that's a big part of the success of CVS Health, is that passion for healthcare.
I couldn't agree more. I love being a pharmacist. I've been, out of the stores now for several years, but I would go back in a heartbeat. And in fact, I love it. I think the passion is what drives you going forward. You couldn't be more accurate about that. And I think the reason why many of us go into a profession like pharmacy is about the passion we have for patient care, the passion you have to make a difference in people's lives, and how rewarding it is to be able to see that difference in front of your eyes. And, I bleed CVS red, but I bleed the passion of pharmacy. And it's very important for us to care about the role that we can play and continue to advance the role that pharmacists can play within this very complex healthcare environment. And I think that we have a very, very important role we can play to help with adherence, with compliance, with, medication management, with helping people that have, very complex chronic illnesses and diseases that rely on pharmacists to help them with, the multiple medications they're on. And regardless of what field of pharmacy you're in, that's a passion in itself that, you wake up in the morning feeling good about it and you go to bed at night knowing that you've made a difference. And I've been very fortunate that CVS Health has that lead with heart mentality and really does care about that end user being our patient and our customers. And we strive to look for great pharmacists who share that same passion, who want to come to work every day knowing that, the expertise that they have makes a big difference to every patient that we serve. And you wake up every day knowing that you're making a difference, and nothing's better than that.
I thank you so much for being part of this series, Building Your Pharmacy Career, and CVS Health really leading in so many facets of what is pharmacy. And I also thank you for helping to sponsor this series to get this message out to those aspiring pharmacy future leaders that are out there, and just being part of the show.
Well, thank you so much for having me, Todd.
You're listening to the Pharmacy Podcast Network, sponsored by CVS Health Careers, Building Your Pharmacy Career, part of this series, part 2. And we thank you so much for listening.